guys, it is May the 31st, 2024. I hope everybody's having a beautiful day today. I just want to start off today's video and say thank you so much to everybody that, prayed for Cindy and Crystal yesterday. All the well wishes, everybody that hopped in. Yesterday's video got a lot of views, and I just want to say thank you so much to this beautiful community, everybody jumping in there, and just saying nice things. I'm sure Crystal and Cindy are going to go back and they're going to see that video, and they're going to see just so many people that reached out and said such loving and beautiful things to them. All the people that prayed for them. I have not heard from either of the two of them yet, and I really hope that they're okay. Cindy and Crystal, if you're watching this, I'm still praying for you. Please reach out to me whenever you can get an opportunity to do so. I'm really worried about you guys. I hope that you guys are okay. But please reach out and let us know. The community's really worried about you guys, and once again, I hope you guys are both doing well. But anyway, I'm gonna go ahead and hop into today's video. I want to talk about what an ERCP is and just kind of give you some some details about what you want to do going into an ERCP, just some tips and tricks, and just kind of give you an overview of what it's like, just some things that you need to know. One of the things about this is that if you're dealing with any kind of alcohol related health problems, you're most likely going to have to deal with an ERCP at some point. And not all ERCPs are connected with alcohol abuse by any means. They do ERCPs for all kinds of different things. But the thing is that if you are having pancreatic problems, liver problems, things of that nature, you're probably going to have an ERCP done at some point, if not multiple ERCPs. It's just part of the game, and it just comes along with this. The first time I had my ERCP done, the nurse was getting me ready, and she said, this isn't your first time having one of these, is it? And I said, it is. And she was looking at my chart and saw my medical history, and she's like, you've never had an ERCP done before? And I told her, no, I have yet to have one done. She's really surprised. She said, you would think that you would have already had a few of these done already. And I told her, no ERCPs yet. And I had my first ERCP done. My first ERCP was last year. I don't remember what month it was, but I had, I think, a dozen ERCPs, if not 13 ERCPs done last year. It was a lot. I was having ERCPs done every month, if not twice in 1 month. I had to keep going back over and over and over again. I was having a lot of issues. I had a total blockage in my pancreatic duct. I got pancreatitis last year, and was in the hospital, actually at a local hospital here, at Doctor's Hospital in Augusta, Georgia. And they had done a bunch of CAT scans and MRIs and stuff like that, and they had sent all of that information down to my pancreas doctor specialist in Charleston at MUSC. And that doctor discovered that I had a full pancreatic duct blockage. It was blocked totally. So they told me, you need to go straight down to Charleston. And I left. My wife drove me down there. They talked about sending me on an ambulance, but the doctor was like, I think you're stable enough to go down, and if we have to wait on an ambulance, you're gonna have to wait for a couple days probably, so we want you to go down now. So my wife drove me down there, and I had an ERCP done a couple days later. They were really, really full at the hospital when I got there. It's a really long story, and I'm not going to get into that today. But that led into a whole host of ERCPs after that. I had to keep going back down there over and over and over again to have ERCPs done. So I've got a lot of experience with ERCPs. I'm sure a lot of you guys out there who are watching have all had some kind of experience with ERCP, or not, if not multiple ERCPs yourself. Well, for the people out there who have never had an ERCP, might be dealing with some problems that, could potentially might have to have an ERCP done. I just wanted to just talk about this today, and just to make it, so if in fact that is something that comes up, your doctor discusses it with you, and it's not this unknown territory. It's something that we've already talked about, and I've given you somewhat of an overview of what it's like, and you're not going to go into this, really afraid, not knowing what's going to be on the other side. At the end of the day, ERCPs, I've had a lot, and I've had some that weren't the most fun in the world. But for the most part, they're not that bad. I'll just go ahead and say that now. They're not. They are scary, and one of the scary things about an ERCP is that whenever you when you go to the hospital, the nurse is going to get you all set up. They take you in the pre-op, and they get you changed and all that kind of stuff. And when the doctor finally comes into the room before they do the procedure, he's going to tell you what he's going to do. He's going to have some paperwork in his hand, and he's going to have a document, and it's going to say that the ERCP can cause pancreatitis, and it can actually cause death as well. And it's just a consent form that they've told you the risks that come along with this, and that can be kind of scary when they have you sign that, but don't be too concerned with it. They just have to cover their end of it. And I've had a whole bunch of them done. They, in the hospital that I go to, MUSC in Charleston, every time I go into that area, multiple people, I mean, that place is full, and they're just turning people all day long. They do tons of ERCPs down there, and every time I go, every room is full. So they're turning and burning ERCPs in Charleston. They're really good at what they do down there. If any of you guys, if you're kind of close to South Carolina, and your hospital that you're at, your local hospital or a hospital that's closest to you, they don't do ERCPs, and you might be able to go to Charleston, I would highly recommend going to MUSC in Charleston for your ERCP. My doctor who's down there, his name is Dr. Morin. He's an Irish guy, really tall. He's got a beard. Super nice guy. He's got a really thick Irish accent. But I'm just telling you this just if you got to look him up or whatever, or whatever, that's who he is. He's got a beard, dark hair. He's a really, really good guy, and he really cares about what he's doing. The guy saved my life. I'm just being completely honest with you guys. And if you are looking for a good doctor, you're close enough to South Carolina, your insurance will allow you to go to MUSC, ask for Dr. Morin, and definitely go see him. The guy's really, really good. But let's go ahead and talk about today just some of the things that you need to be prepared for. Well, let's talk about what is an ERCP first. Well, an ERCP is an acronym that stands for endoscopic retrograde cholangiopancreatography. Cholangiopancreatography is what it is. And that's basically where they just, it's kind of like an endoscopy, but they go in with a scope, and they have tools that they go in there with. They got like needles, they got like little like pincher arms they can go in there with. They've got things like balloons that they'll put up in there, and then they'll inflate, and then they'll pull them through like your bile duct. They can pull them through your pancreatic duct. They have balloons that they can inflate to dilate the pancreas. There's a bunch of different things that they can use. But, once again, it's basically just like an endoscopy, except they're going in there and actually doing some stuff. They got a camera with a light on it, and then they got different tools and things of that nature that they can go in there and do stuff with. They do sometimes will have you on a table with like an x-ray. I think it might do it every time. I just know that when I've gone in there, there's been certain times they've put me up on that table and they've like had like an x-ray machine that they put over top of your stomach. And other times they didn't do that. So I don't know if they do that every single time or not. I don't know. I'm unconscious every time that I'm in there. I'm in there at the beginning. I'm awake for that part, but then they put me under. Which that one thing about doing an ERCP is they do put you under when you have that procedure done. You're not awake for it. So when you go in, they're gonna get you all set up, which I'm gonna go through all this kind of stuff here and talk about what they do in preparation and what you should do to prepare. But they'll take you to pre-op, do all that stuff. They'll wheel you to the back. You'll go back there. They'll kind of talk to you for a minute, and then the anesthesiologist will come in and they actually talk to you in pre-op, and then basically tell you what they're gonna do, and then they'll take you to the back, and then the anesthesiologist will come in and administer the medicine, and they'll put you to sleep. And one minute you're here, and the next minute you're out. From your standpoint, it's like you close your eyes and you wake up and it's all over. But the ERCPs can take, an hour. Most of them take about an hour. Sometimes it could take 2-3 hours, just depending on what they're in there doing. I've had ERCPs that were 30 minutes. I've had ERCPs that were 3 hours. So it just really depends on what they're doing. Like one time I went in there, I had a full pancreatic duct closure. They were trying to get it open. They couldn't get it open. So they spent a lot of time trying to get through that duct. And then I had some cysts that were growing on my pancreas, so they put stents into those. So it was a drawn out process. So those took some time. But then like the ones where they went in and just pulled the stents out, that was like 30 minutes. It wasn't long at all. So it just really just depends on what they're going in there to do. Like getting ready for an ERCP, one of the first things that you're going to want to do is you're going to want to remove all of your jewelry. If you wear rings or any of that kind of stuff, necklaces, any jewelry has to go. And I would suggest go ahead and just get it off before you go to the hospital. Because especially like wedding rings and stuff like that, you know how hard they can be to get off sometimes, especially if you don't take it off very often. It can be tough getting those off. So just go ahead and, get some soap, get that off your hand before you go to the hospital. Just take off all your jewelry. That way you don't have to worry about it. You don't have to worry about it going missing or anything like that. Just remove it before you even go to the hospital. Another thing too is wear clothes that are like kind of loose, easy to get on and off. I would suggest wearing something like jogging pants, and socks that are very easy to get off, and socks that are easy to get back on. Maybe I would definitely wear like some kind of slip-on shoes, something that you don't have to bend over and tie. And I'll go into that in a little bit, but just wear something that's easy to get on and off your feet. And a shirt that's easy to get on and off too. I would just wear something that's really comfortable, easy to get on and off. Because when you get there, you go into pre-op, they're gonna make you remove all your clothing. You cannot wear underwear, so those have to go too. So I'd wear some underwear that are easy to get on and off. I wouldn't wear your nicest pair of underwear that you got. Just wear some clothes that are, that you don't care much about or easy to get on and off. Because once you get in there, the first thing that they're going to do is they're going to take you to your room. They're going to tell you to remove all your clothes. They're going to give you a pair of socks. Even the socks that you have on, you can't wear those either. They're going to make you put those socks on. They look like totes. If you guys remember the tote socks from back in the day, they got like little grippy pads on both sides. And they suck. I hate those socks. They don't stay on. They're loose. But they want you to wear those because if you have to get up and go to the bathroom or something like that, they don't want you slipping. And they're going to give you a gown. And those gowns are always a pain in the butt to get on. So I'll go in there, if my mom's with me or my wife's with me or something, I'll go ahead and put it on and get them to help me tie it in the back. But definitely go ahead and remove all your stuff and make sure you got something comfortable on when you go in there. Because especially after your ERCP, you're going to want to put on, be able to put your clothes back on and not have to fight with putting on a belt and all this kind of stuff and jeans that are tight. you're not going to feel all that great after that. You're going to be kind of tired. You're probably going to be pretty loopy. So just wear something that's easy to get on and off. No food or drink for 12 hours before, and like you cannot have anything to eat or drink. They're going down your esophagus, and because they're going through your mouth, going down your esophagus and going in through your stomach and all that stuff. You can't have food in there at all. So don't think that that you can have a cup of coffee that morning or something like that, and they're gonna know. And if they go in there and they see that there's stuff in your stomach, they're gonna stop the procedure. You just wasted their time, your time. You don't want to do it. I know it's not fun. You can't drink anything in the morning. You're thirsty, but that's another reason that you want to make sure. If there's anything on this list that I can suggest to you guys that I think is one of the most important things about this, try to get yourself an appointment early in the morning. That way, you have your last meal that night. You go to bed, you wake up, you go straight to the hospital, have your procedure done, you are finished, and then you can have food and drink after you're done with your procedure. And you're not waiting all day. I can't tell you how bad it is when you're, you had to have your last meal the night before, and then you're waiting all day. I mean, you will be so thirsty and hungry and all that kind of stuff. You just don't want to have to deal with that. So try to get an appointment first thing. That's what I do every time. If they tell me it's going to be another week before I get my procedure because I don't want an early procedure, I'll wait. I'd rather just go in there first thing in the morning. I'm always the first patient of the day when I go. No diabetes medications the morning of. And if you take like Jardiance or metformin or something like that, you cannot take your diabetes medications in the morning of your procedure. You're going to be under, and they don't want your blood sugar dropping while you're in the middle of having a procedure done, because that's a whole nother monster they're going to have to deal with. So they don't want you taking that stuff. And if you take long-acting insulin, so you definitely don't take any fast-acting insulin the morning of. But if you take long-acting, they only want you taking half of your long-acting insulin the night before you go in for your procedure. So just keep that in mind. Let them know if you are allergic to contrast. They're going to ask you, but if you have any problems with contrast majority of the time is part of their procedure. They'll shoot contrast in through your pancreas or your bile ducts or whatever. So you need to make sure that you let them know if you have a problem with contrast, because that's going to change some things. No blood thinners. If you're on blood thinners, like Eliquis, I'm on Eliquis. I take it twice a day. But if you're on blood thinners, they do not want you taking your blood thinners 3 days before. So if you are on blood thinners, you need to let them know, and you're probably going to have to get on a bridge. So it'd be something like Lovenox, and then you're going to have to give yourself injections twice a day. It's every 12 hours, 3 days leading up to the procedure. So, if you're not comfortable giving yourself injections, the needles are kind of long. If you are okay with it, it shouldn't be a problem. But if you're not, you might need somebody else to help do that for you. I don't know if they can give that to you in pill form or not. Anytime I've ever had the bridge, it's always an injection. I don't have problems giving myself injections. I give myself insulin multiple times a day. But I'm sure, I know there's a lot of people who are scared of needles and stuff like that. So if that's something that bothers you, talk to your doctor. I don't know if there's an option that they can give or not, but just be forewarned that if you are on blood thinners, they're probably going to bridge you, and you're going to have to give yourself injections or get somebody to do it for you. You will need a driver. They will not do the procedure if you do not have someone to drive you home. And they will want to check who your driver is. So like when you first walk into the hospital and you get to the unit where they do the ERCPs, they're going to want to see your driver there. And they're going to get their driver's license and their tag number a lot of times. You got to have somebody drive you home, because like I said, you're being put under. They will not let you do the procedure if you don't have someone to drive you. If it was me, and I'm just telling you this, if it was me and I'm going to the hospital to have an ERCP done, depending on what they're doing. If they're going into the hospital, and if you're going in and you're just having a stent placed in a cyst, or they're going in there and just maybe placing a stent in, they're placing a stent in your pancreatic duct or bile duct or something like that. Depending on what they have to do, I would definitely speak to your doctor about it and ask them, what are you doing? How long do you think this is going to be? And do you think I should stay overnight? Because if they have to go in there, if they have to dilate your pancreatic duct or your bile duct, when they go in there and they dilate it, they put a balloon in there and they inflate it. And I'm just going to tell you, I'm not trying to scare you, but it hurts when you wake up. And the one thing about these ERCPs is as well is that when they do the ERCP, when they have you sign that piece of paper, it states on there that if they're doing anything with your pancreas, there's a 5 to 15% chance of that procedure causing pancreatitis again. When they're in there, because they're in there, fooling around with your pancreas, and just touching the pancreas can cause pancreatitis. So there's a chance that you can end up with pancreatitis from having the procedure. And one of the things with pancreatitis is that fluids are very important, but intravenous fluids. You don't want to be drinking, when you have pancreatitis. So depending on what they're doing, I would suggest asking the doctor maybe about staying overnight, especially if they're going to be in there dilating your pancreatic duct or going really deep into your pancreas, because it is painful, and there is a probability of you getting pancreatitis from that procedure. And depending on how busy the hospital is, how many beds they have or whatever, but if you ask to stay, most of the time they're going to allow you to, and they've never told me no. And I've asked to stay a couple times when I've had them done. The first few times I didn't. Well, actually, the first time I was in there, I was actually in the hospital. I was already hospitalized with pancreatitis when they went there and did it. But the other times I'd gone, I didn't stay. But then they did it. They went in there and they dilated my pancreatic duct. And I went home. And I was very scared because it felt just like pancreatitis. I was in a state of pancreatitis for quite some time. But it really felt like I was in like full-blown, really bad pancreatitis during that period of time. And I'd come home, and it's a 3-hour drive for us to go down there. And I wasn't going to one of my local hospitals with that. I was going to have to go back down to Charleston, and it really frightened me. So after that, I stayed overnight. Unless it was really something simple. Like the last time I went, they were just removing the stents, and it wasn't that bad. So I did not stay. But just to throw it out there, talk with your doctor and see if maybe it's an option for you. Just stay one night, for one, so they can monitor you and make sure that nothing bad happens. But two, it can be painful, and you want to regulate your pain, and the hospital is going to do a good job of that for you. They're going to give you intravenous pain medicine. That stuff works immediately. I'm not saying that it totally cancels the pain out, because it doesn't, which was another thing I was going to talk about. Something that I've done when I've been in the hospital and they've done an ERCP, and they've gone in there and they've really irritated my pancreas. They have given me a ton of pain medication. And I mean, they were like coming back, because I was literally screaming when I woke up. Like crying, screaming. I hurt so bad. My stomach was it felt like somebody stabbed me in the stomach. They just kept giving me pain medication over and over and over again. They could not get my pain under control. And I asked them for a big bag of ice, and the nurse went and got me one, and I put it on my stomach. I cannot tell you how much better my stomach felt. If you start to have really bad stomach pain after they do that, ask them for one of those ice packs, or a couple ice packs, or a big bag of ice. Place it on your left-hand side of your stomach and let it sit there. It will help the pain tremendously. Just a tip there for you. Okay, we talked about needing fluid. Definitely bring something with you, like a book or a tablet or something like that, because after you wake up from the procedure, they're gonna make you hang around for a while, and there's no TVs or anything in there. You just have something to keep you kind of busy, because you're gonna have to hang out for about 2 or 3 hours after you wake up. They just want to make sure you're okay before you go home. Consider bringing something like some throat lozenges or something like that, because they are going through your mouth down your throat, and every time I've woken up from an ERCP, my throat hurts really bad. I mean, they're in there jamming stuff down your throat. So, some cough drops or something like that, some mints or something that, when you wake up, because your throat is going to hurt. Just be mindful of that. And some lip balm. I would have like some chapstick or something like that, because your lips are going to be really dried out. I mean, they put a thing inside your mouth to hold your mouth open while they're shoving all that stuff in and out of your mouth. And your lips are going to be really dried out and cracked. So bring some chapstick to put on your lips after you wake up, because they are going to be really dry. If you have any dentures or partials or anything, those need to be removed as well. I would just go ahead and pull those out. You don't want to lay those around in a hospital room. I know it's probably not going to be the most comfortable thing going in there with your dentures or your partials out. And I'm actually having partials made here in the next month. So, I mean, I'm going to have partials. I've already had my teeth pulled. So, I mean, I haven't had them yet, but if I have to go for another ERCP, I'm gonna have to pull my partials out when I go in. I wouldn't want to lay them around in a hospital room. Another thing too is they tell you no major decisions the day of your procedure, because you are completely put under, and you don't want to go out and sign some kind of major document or something like that. You just basically take the rest of the day off. Get your driver to take you home and just go home and rest. Don't try to do anything. Don't try to go back to work. Don't try to go to the mall or anything like that. Just go home and rest. You need to. If you have any bleeding after your ERCP, so if you vomit and there's blood, if you have blood coming out of your other end, something like that, you gotta talk to your doctor. You gotta call them immediately, because that could be something really serious. So just be mindful of that. If you do experience any kind of bleeding or anything, you need to, and they'll give you an emergency contact number when you leave with all your paperwork, and they will tell you that when you're done, that if you have any bleeding or anything, call this emergency number, because they're probably going to want you to come back immediately. I already talked about if they dilate your pancreatic duct or something like that, it's going to be pretty painful. So, what are the reasons for like an ERCP? It's, basically for like strictures, stones. They can go in there and pull tissue samples, placing stents. They can place stents in your pancreatic duct, in your gallbladder duct. They can, in your bile duct. They can drain cysts. They can go in there and take a look at your pancreas. They can take a look at your gallbladder. They can basically, anything that's in like your upper GI, they can go in there and investigate. They can pull samples. They can, they can basically do anything with your upper GI, except for like major things like, removing something like, if they had to like remove a portion of your stomach or something like that, they're obviously not going to do that with an ERCP. But if they need to go in there and take a look, like they did, and they'll usually do like an MRI before, or a CAT scan before the ERCP. But this is like more in depth, and if they find something on the MRI in your pancreas, this might be where they go in and they might want to take a look at it. There might be a spot, let's say, on your pancreas. They can go in there and get a more intimate look at that spot on your pancreas. They can go in there and take a tissue sample of it or biopsy, and actually get in there and take it out, and then, you know, have that biopsy sent off, or, you know, take a really hard look at it and see what they see from the camera as opposed to just imaging. But it basically anything associated with your pancreas, your gallbladder, your stomach, your esophagus, any of that area, that's what they use them for. But a lot of times, it's for like placing stents in our bile duct or in our pancreatic duct, or draining cysts off and stuff like that. But I just wanted to make this video today and just kind of give you like an overview, some little things just to what to expect. Like I said, it's really not that big of a deal. So don't worry too much if your doctor's told you that you need to have one. You go in, you're in and out of there in 4 or 5 hours, and you know, you're gonna feel kind of yucky for the rest of the day, especially since they put you under. You just never quite wake up from that fully that day. But you're just gonna feel kind of gross. You know, just plan on taking the rest of the day off. Definitely try to get an appointment in the morning. But you'll go in, you have your procedure, you're gonna hang out for a little bit, and then you're gonna go home. And just plan on to spend the rest of the day just resting. And don't try to push yourself too hard. But it's not that big of a deal. It's not that scary. It's not that painful. It can be. But the pain usually, like if they had to like dilate your pancreatic duct, it'll last for a day or 2, 3 days maybe. You will have to be kind of careful about what you eat for the next couple of days. You know, especially if they've been in there really messing around in your pancreas. You know, you really want to be careful about how much fat that you eat. You don't eat any spicy foods. But that, you know, all that kind of stuff, and I'm not going to get into too much detail about that. I mean, that's pretty simple information. Just look up on the internet and speak with your doctor about. But like I said, it's not something to be totally afraid of. It's rather simple. They do them all the time. And the people are super nice, especially at MUSC. The people that are down there, I know all the nurses down there. It's the same ones every single time. I know them all by name. They're super sweet, super nice. The doctor is super nice. I don't know how many doctors they have that do that, but Dr. Morin is the one that usually, he's been the one that's done them all for me, and he's the one that I always see walking around. They might have like 2 or 3 doctors that do it, but like I said, if you're close to Charleston, close enough that you could drive there and have a procedure, I would highly suggest that hospital because they really are great. But anyway, guys, I think that's it for today, and we're already at 33 minutes right now, so I'm gonna go ahead and hop off of here. Once again, thank you so much, guys, for everybody going on there yesterday and just saying such nice things. I know Cindy and Crystal are going to see that, and it's really going to make them feel so much better, and I really hope they're doing okay. Cindy and Crystal, if you're watching this, I love you guys so much. I hope you're doing okay. Please reach out to me and let me know whenever you guys can. Just let us know that you're all right. And with that said, guys, I will see you guys tomorrow. I love you so much, and I hope you all have a great rest of your day. Bye-bye.